Dr. Angela Gardner was recognized by the Texas Legislature and State Representative Vicki Truit on her election as President-elect of the American College of Emergency Physicians, with a resolution read on the floor of the Texas House earlier this month. Representative Truitt's congratulatory resolution honors Dr. Gardner for her outstanding service in this new leadership position.
Representative Truitt was kind enough to sponsor a resolution, a commendation resolution for me, and is going to be presenting me with that today. I'm very flattered and thrilled to be receiving the congratulatory resolution. It is the highlight of what has been a great year, and I look forward to meeting her and accepting that. I have great visions for the American College of Emergency Physicians. Obviously, what's first and foremost on everyone's mind is the effect of the economy on access to health care. We in the emergency departments know that people without insurance will be turning to us for all of their care, and we need to be ready to help people get that care. We're also working very closely with the President in his roundtable discussions and in his healthcare reform policy discussions, and we'll be a part of that in a very big way. Acute care is something that's largely been overlooked in the campaign, and we're bringing it to the front, bringing it to the President.
Prior to her election as President-elect, Dr. Gardner held numerous positions with the organization and in the Texas chapter of the ACEP, the Texas College of Emergency Physicians. Dr. Gardner and the Texas College of Emergency Physicians were both instrumental in the passage of the 2003 medical liability reforms in Texas.
As we came into the 2000s, emergency physicians in Texas were under the gun. 1 in every 2 emergency physicians had a suit pending in 2001, and most of those were frivolous suits. A great many of those physicians had 2 suits pending. And these were good doctors, and they were being driven out of the state, going to places where this wouldn't happen to them. So we fought hard for tort reform in Texas, and we got a number of those reforms, and it has helped immensely. We now have 38 counties in Texas that have emergency physicians that never had emergency physicians before. And we have 88 counties in Texas that have more physicians that practice emergency medicine than they've ever had. If you listen to the news, you hear what the priorities are going to be for emergency medicine. Well, number 1 will be access to emergency care. We have to get people able to see emergency physicians when we need them. 2 will be healthcare reform. The President has focused on chronic care and getting people the primary care providers that they need. But when you have a heart attack, you need an emergency physician. And my job is to make sure that you'll have that emergency physician.